Professor and class. My name is Kelly Jahansky, and this is my persuasive speech for Dr. Halls online class for Speech 101, course number 8012. I'll be using some notes that I wrote down and also a little paper that I wrote on here. Okay. Persuasion, it's the act of causing people to do or believe something. It's a way of thinking. This process is aimed at changing how a person or a group sees something. There must be good reasoning involved when trying to convince your audience, like statistics, evidence, charts, as to why their beliefs should switch up. Make that light bulb go off in their head, or as I would call it, an aha moment. So my persuasive speech that I wrote is about medical decisions for children made by their parents or guardians. Parental decision making concerning the health and well-being of a child has been a controversial topic for many years. Medical decision making is a complex issue and can become a debatable topic amongst others, especially people who don't know the patient's full medical history, anything about them, their condition, or how their condition even started. Outsiders are likely to either support the parent in their decision, or totally be against it. When a child is terminally ill, I believe parents should have the right to make life decisions pertaining to their health, as they are too young and capable of doing so, so I believe it's in the best interest of the patient, and it's in the best interest of the parent to make that decision. As such a significant decision to make for one's life, some people will question the parent's emotional state, obviously. The parent could be too emotionally involved with what the child has going on. If it's a severe illness, anything, they might be so wrapped up emotionally that they're not capable of making a rational decision. According to the U.S. National Library of Medicine, National Institute of Health, a parent needs to make their decision based on the best interest of the patient's health. They need to think about the child's health first and foremost, and they can't let any thought or outsiders have any input to what decision they make. They need it in the best interest of the patient and their health and get better. The U.S. National Library of Medicine National Institute states that a parent needs to look at their chance of survival first. If the patient has a really good chance of surviving their illness, then look at that first. The harms and benefits of treatment, if it's going to affect the child in the long run or be better for them. The short-term and long-term outcomes of the treatment and the long-term suffering of the patient. So if the treatment's better for them or if they're going to suffer down in the long end. They also need to think about the quality of life that they would live after the medical decision that they make for the child. Based from the University of Washington, medical caretakers and others should challenge parental decisions if those medical decisions put a child at risk. So medical caretakers have the right to go through the judicial system or the state child protection agency if a guardian's decision seems unsatisfactory. So they can go to court and fight them if they think that they're putting the child's health or even their life at risk. The age of a child may also play a factor in the debate of this issue. Some will argue, when is a child old enough to make a rational decision or have reasonable input about their own medical decisions? Every state has their own individual emancipated minor laws regarding their right to make decisions for themselves. Typically, the child will have an input about their health decisions unless they're incapable of doing so. If they're in a coma, if they're not able to speak or make a rational thought, then it's up to the parent. Washington University reads that children with the developmental ability to understand what is happening to them should be allowed to participate in discussions about their care, which I also believe is good. In other words, children should be able to voice their opinion if they have the ability to make decisions for themselves. When a child is at a young age, their decision-making capabilities just start to develop in their teen years. So the ability to weigh out different options doesn't really occur, or they don't understand both what short-term and long-term effects can have. It's hard for them to really differentiate between what the outcome of something can be. Although some people will be on the parent's side and believe it is a decision totally up to them, I believe the overall decision in the best interest of the patient should come from the parent. The guardian has the right to make health decisions for a child who is incapable of doing so, and society should be more accepting of their rights too. Not everyone who voices their concern for the well-being of adolescent patients even know their concern, their condition, or a full medical history. They just base it off what they see, not what they really know. Clearly, we all must work together and think of the best interest of the patient before we pass judgment on such a heavy issue. I believe we need to stop judging people because you never know what kind of battle they're really facing and what their medical history really is. In the words of William James Mayo, who is the founder of Mayo Clinic in Rochester, Minnesota, the best interest of the patient is the only interest that should be considered. So, this concludes my persuasive speech, and I hope your beliefs towards this subject grew stronger and you see the light a little differently. Thank you.